Charles Fox. I'm a nurse practitioner and I'm going to be taking care of you today. I would like to be addressed as Charles or Mr. Fox and I identify as him. Before we get started, can you tell me your full name and date of birth?
Tara Fox, and it's August 6th, 1988.
Okay, and how would you like to be addressed?
Tara, and I identify as her.
Okay, so what brings you in today, Tara?
Just a physical.
Okay, how would you describe your health over the past year?
Good.
Okay, do you have any new concerns over the past year?
No.
Are there any new restrictions or limitations on things that you used to be able to do that you can't do now?
No.
Okay, what medications do you take, Tara?
I take Synthroid 50 micrograms daily.
Okay, and do you do the appropriate follow-up lab work for that Synthroid?
Yes.
Okay, and when was the last time you had that?
Within the last year.
Okay, do you take any herbal supplements or over-the-counter medications?
No.
Okay, so at this point, I would like to recap that you came in today for a health visit, physical screening, that your health over the last year is normal with no new complaints and no new limitations or restrictions, that you take your Synthroid and you do the appropriate labs follow-up in the last year. Anything else you would like to address?
No.
Okay, so we're going to discuss your health history. How would you describe your overall health?
Good.
Okay, any childhood illnesses like measles, mumps, rubella, chickenpox, or polio?
I did have chicken pox as a child.
Okay, any adulthood illnesses, high blood pressure, diabetes, kidney disease, liver issues, lung disease?
Just the hypothyroid that we talked about.
Okay, very good. Are you up to date on your vaccinations?
Yes.
Okay. Any hospitalizations in the past?
Just when I had my children.
Okay, any surgical history in the past?
Again, just my C-sections with my children.
Okay, any complications from those C-sections?
No.
Okay. Any serious injuries or disabilities?
No.
Any allergies, foods, medications, seasonal allergies?
No.
Okay. Any history of transfusions?
No.
Any recent screening tests done?
Oh, I get my skin checked yearly at the dermatologist.
And when was the last time you had that skin check done?
Just like 2 weeks ago.
And was it normal?
Yes.
Okay. Any mood disorders or psychiatric issues?
No.
Okay. Any changes in your mood, difficulty concentrating, any depression, suicidal thoughts or ideations?
No.
Okay. Next, I would like to discuss your family history. We'll start with your father. Is your father alive or deceased?
He's alive.
Okay. And how old is he?
He's 64.
And how would you describe his overall health?
He's fairly healthy.
Okay. Any medical conditions your father has?
He has hypertension and hypothyroidism.
Okay. And moving on to your mother. Is she alive or deceased?
She's deceased.
Oh, I'm sorry to hear that. How old was she?
She's 47.
And do you know her cause of death?
She had anorexia and had complications from that.
Did she have any other medical conditions at the time of her passing?
She had stomach ulcers.
Okay. Do you have any siblings?
I do not.
Okay, I'd like to talk to you about your grandparents. So we'll start with your paternal grandparents, that's your father's side. So your paternal grandfather, is he alive or deceased?
He is deceased.
Okay, and how old was he?
84.
And do you know the cause of death?
A stroke.
Okay, did he have any other medical conditions?
He had epilepsy.
Okay, and how about your paternal grandmother? Is she alive or deceased?
She's deceased as well.
And how old was she?
Also 84.
Okay, and do you know her cause of death?
Lung cancer.
Okay, did she have any other medical conditions at her time of death?
She had type 2 diabetes and she had hypothyroid as well.
Okay, and how about your maternal grandfather? Is he alive or deceased?
He's also deceased.
Okay, and how old was he?
89.
And do you know his cause of death?
Alzheimer's.
Okay, did he have any other complications or health problems at his time of death?
Not that I know of.
Okay, and how about your maternal grandmother? Is she alive or deceased?
She's alive.
Okay, and how old is she?
She's 96.
Okay, and how would you describe her health?
For 96, she's well.
Okay, does she have any other medical conditions that you know of?
Actually not really.
Okay, moving on, I would like to talk to you about your social history. Where were you born and where did you grow up?
I was born and raised in Youngstown,
Okay.
Ohio.
Okay. And how was your home environment growing up?
Good.
Okay. And what is your highest level of education achieved?
I have a bachelor's.
Okay. And what's your occupation?
I'm a registered nurse.
Okay. And how many hours a week do you work?
Typically 32.
Okay. And tell me about your current living situation.
I live at home with my husband and my children.
Okay. And what do you do besides work that gives you interest or hobbies?
Um, I spend time with my kids. I run for exercise.
Okay. And how often do you run per week?
Usually 3 times a week.
Okay. And how long do you run?
3 to 4 miles.
Okay. And how would you describe your nutritional history?
It's good.
Okay. Any complementary or alternative diets?
No.
Okay. And how much caffeine do you intake? Coffee, tea, cola per day?
1 cup of coffee every day, and then sometimes once in a while a second cup or a soda in the afternoon.
Okay. And how would you describe your overall sleep?
Pretty good.
Okay. Any tobacco use?
No.
Any illicit drug use?
No.
Okay. Any alcohol intake?
Just socially drink a couple drinks a week.
Okay. So how many drinks total do you think you have per week?
4.
Okay. And how do you deal with stressors in your life?
Exercise, being outside.
Okay. And any travel anywhere or exposure to contagious illnesses?
No.
Okay. Any military service?
No.
Okay. Any religious beliefs or practices?
Catholic.
Okay. And any concerns regarding access to care?
No.
Okay. I would like to talk to you about your sexual history at this point. Are you sexually active?
Yes.
Okay. Do you practice any form of contraceptive?
No, my husband had a vasectomy.
Okay. And then any current or present form of sexually transmitted infections?
No.
Okay. So I would like to recap your history, your social history, and your family history. It looks like you're moderately healthy. You exercise regularly. You eat a normal diet. Your father is healthy as well, and your one living grandparent is your maternal grandmother, who's in her 90s and living well. Is there anything that I missed or didn't touch on?
I don't think so.
Is there any other areas that you would like to address?
No, not at this time.
Okay, so next I'll be going through the review of systems, which is just talking about the different body parts and asking questions specific to those body parts. In general, do you have any fever, chills, general fatigue, any pain, any night sweats?
No.
Talking about your hair, skin, and nails, any abnormal growths?
No.
Okay, and you did say that you follow up with the dermatologist regularly. Any itching or burning or rashes noted anywhere?
No.
Okay, with your head and the neck, any headache or neck pain?
No.
Any difficulty moving your neck side to side or any complaints therein?
No.
Okay, any previous head injuries or loss of consciousness?
No.
Okay, any neurological concerns?
No.
Any tremors or muscle weakness or paralysis? Any
No.
tingling in your extremities?
No.
Any impairments in memory?
No.
Okay. Any changes in your hearing or hearing loss?
No.
Any ear pain or discharge from your ears?
No.
Any ringing in your ears?
No.
Okay. And moving on to your nose, any changes or loss of a sense of smell?
No.
Any pain in your nose or postnasal drip?
No.
Okay. Any bleeding from your nose?
No.
Okay. And how often throughout the year would you develop a cold?
1 to 2 times a year.
Okay. Any issues with breathing?
No.
Any pain on breathing?
No.
Okay. Any shortness of breath with activity?
No.
Okay. Any coughing or coughing up blood?
No.
Okay. Have you ever had any radiology or workup done on your lungs?
No.
Okay. And with your lymph nodes, the little bumps on your skin, have you noticed any tenderness or enlargement?
No.
Any redness noted over the lymph nodes?
No.
And for your throat and your mouth, have you had any changes or loss in the sense of taste?
No.
Okay. Any enlargement or bleeding of your gums?
No.
Okay. Have you had any hoarseness or loss of your voice?
No,
Do you follow up regularly with a dentist?
I do.
Okay. And when was the last time you saw a dentist?
Um, Within the last month, I go every 6 months.
And was everything normal at that visit?
Yes.
Um, any issues with tenderness or pain in your breasts?
No,
Any discharge from your breast?
no,
Okay. Any chest pain, palpitations, or exercise intolerance?
no,
Okay. Any edema or swelling of your extremities?
no.
How many pillows do you sleep with at night?
2.
Okay. Have you ever been told that you have high blood pressure or high blood pressure readings at previous visits?
No,
Okay. Have you had any cardiac workup done?
no,
Okay. Any abnormal bruising or bleeding noted?
no,
Okay. Have you ever had a blood clot?
no,
Okay. Any abnormally low blood levels or history of anemias?
no,
Okay. Any issues with digestion or heartburn?
no,
Any nausea, vomiting, or diarrhea?
no.
How would you describe your normal bowel habits?
Regular.
Okay, and about how many times do you have a bowel movement per day?
Once a day.
Okay, all right. Any abnormalities in the consistency or the color of the stool?
No,
Okay, so no clay color or blood noted in your stool.
no,
There's no jaundicing or yellowing of the skin or the eyes.
no,
Have you ever been told that you have a gallstone, an ulcer, or a polyp?
no,
Okay, any GI workup done before in the past?
um,
Okay, any change in your appetite?
no,
Any dietary restrictions?
no,
And then do you take any dietary supplements?
no,
Have you had any problems with urination?
no,
Okay. Any pain, flank pain, or blood in your urine, or pain when you urinate?
no,
Okay. Any urgency or hesitancy with urination?
no.
Okay. Have you ever had a urinary tract infection?
When I was pregnant,
Okay. And did you have any complications from that?
no, I just had an antibiotic and it was fine.
Okay, good. Have you ever noticed any enlargement or tenderness of the thyroid, the gland in your neck?
No, they ultrasounded it when they started me on Synthroid and it was fine.
Okay. No issues with heat or cold intolerances?
No,
Okay. No unintentional weight loss?
no,
No increasing size of your hands or needing larger hats?
no,
Okay. No symptoms of diabetes, the excessive urination, excessive thirst, or excessive hunger?
no,
Okay. Tara, do you have any concerns about your menstrual period?
no.
Okay. When did you first start your menstrual period?
I was 11.
Okay. Any intermittent bleeding or pain outside of your normal menstrual cycle?
No.
When was your last pap smear?
This year
And what was the result?
it was negative.
Okay. And how would you describe your muscles and joints?
Um, Fine.
Okay. Do you have any muscle pain, any muscle weakness?
No,
Do you notice any joint stiffness?
no,
Okay. Any bony deformities or pain with range of motion?
no.
Do you use any assistive devices?
Just a little brace on my knee when I run.
Does it help at all?
Yes.
Okay, very good. Tara, I would like to lastly discuss your pregnancies. How many times have you been pregnant?
3.
And then how many children do you have?
I have 2 kids. I had a miscarriage in between the 2.
I'm sorry to hear that. Do they have a reason for the miscarriage?
Not that I know of.
Okay. Were there any complications from the miscarriage and or the pregnancies?
No.
And then how would you describe your overall pregnancies?
Regular.
Okay, so Tara, that completes our health assessment today. I would like to kind of recap the review of systems. Essentially, it seems pretty normal. With your head, ear, eyes, nose, and throat, you have no complaints. With your skin, you do follow up with dermatology regularly to check skin checks. You have no cardiac complaints, nor no pulmonary or gastroenterologist complaints. The only thing is you have the hypothyroidism, but you don't have any symptoms of hypo or hypothyroidism with no thyroid gland tenderness. And then you did have the 3 pregnancies with the 1 miscarriage and the 2 births without any significant complications from those. Is there anything else that you would like to address today?
I don't think so.
Okay, well thank you for your time and allowing me to participate in your care.
Thank you.